I mean, I think the issue of vaccine hesitancy has actually grown over the past decades. You know, when I was immunized, the threat of polio and measles was an important consideration for my mom. In some ways, vaccines today are suffering from their success. We don't see the types of diseases that vaccines prevent against. I think that's one important issue. The second important issue, I think, is that is where people are getting their trusted sources of information. The dynamic has changed dramatically again over the past couple of decades. People used to trust their physicians more than their neighbors, and now it's the other way around. Social media becomes an important factor in combating vaccine hesitancy because people are now seeking information from sources on the internet, which isn't necessarily the best source of information. I've worked in the global public health world for over 30 years, and one thing I think we've learned is the important role of public-private partnerships. Now that I found myself at an organization like McCann Health, which is one of the largest and most successful health communications agencies, it's become even more clear to me the role that the private sector can play in combating global public health threats. So for instance, what we're doing now in McCann Global Health, a new competency within McCann Health, is to bring the same approaches that an organization like McCann brings to consumer marketing and advertising to getting individuals to take up polio vaccine, or women to exclusively breastfeed, or to combat HIV. All of those are important global public health threats that could benefit from a public sector and private sector partnership. I think one of the most exciting things to me in my professional career was the creation of the immunity charm. It was an insight that came from an interaction with a small child in Afghanistan. And only because there was a creative team available and with the competencies and the passion to take a nugget of an idea and turn it into something incredibly special, did the immunity charm actually come to light. And we're now testing the immunity charm in India, 30,000 children in Rajasthan state. And we hope with that data, we're going to show that where the immunity charm is available, that vaccine uptake is increased and vaccine compliance is increased. And ultimately, that's going to mean many, many more lives of children saved due to preventable diseases. If you had asked me 30 years ago, would I be the global medical director of a large health communications company, I would have said you're crazy. I started my career as a Navy flight surgeon. I flew backseat of F-18s. I ended up working on the Malaria Genome Project and ran the US Navy's malaria vaccine program, which in essence was a small biotech company. We had basic research, immunology research, preclinical research and development, clinical trials domestically and overseas. And now in my role as the Global Medical Director for McCann Health, I feel like I can pull all of those experiences to bear to support not only my colleagues at McCann Health, but our clients. Because I think I see the entire lifespan of the development of a project and product. So I think it's incredibly important. I think also throughout my life, I felt that it's important to just say yes. It's too easy to find excuses for not doing something, and I think I'm here today because of, I think, being a bit bold, sometimes being a bit foolish, but in essence, being able to deliver on whatever the challenge was. And so I'm really grateful for having this opportunity to work with such incredible people on such important topics. In 2010, I was at the United Nations Foundation, and we had just heard about the earthquake in Haiti. And within 24 hours, I was on an airplane to Port-au-Prince to help the UN staff who were devastated by this earthquake. that and many other examples of where I found myself in conflict zones, in places where I was able to see firsthand how people were struggling to survive in very, very difficult situations. I realized that it was so important for us to have a perspective on the actual lives of people living in these areas to make a difference in whatever it was that we were trying to do. So whether it's the immunity charm for immunizations, whether it's understanding the barriers to polio vaccine, or maybe barriers to HIV prevention in young women and girls in sub-Saharan Africa. Unless you really understand the lives of the people that you're trying to influence, you're not going to be able to make a difference. We, in the commercial world, think of as those individuals as empowered health consumers. They're not passive recipients of aid in the way that many people in the public health world think of them. They're empowered health consumers. They may not have much in terms of financial resources, but they have time. And how they invest that time is critically important for the health and well-being of their families. And that's how we tend to think about the work that we do, is through that empowered health consumers lens. In some ways, I have the best job in the world because I get to think about science. I'm a physician and a molecular biologist, and somehow I've found my way to an organization that embraces creativity in a way that I've never seen before. So as a scientist, and now working with over 450 scientists within McCann Health, we're establishing and elevating science to a new height within the health communication space. So besides creativity and strategy, science becomes the third pillar of the work that we do. Because it's so important that as the science advances, as medicine advances, and as our clients are at that pointy end of the spear, we need to be in front of that spear. We need to be with them and leading them towards how those new innovations in health are going to better people's lives throughout the world.